All right. Hello. It's a pleasure to have you, Daisy. Daisy is a mom and an advocate, and she lives in Nigeria, correct?
Yes, I do.
And today we'll discuss autism and advocacy. And but before we start, I'll let you introduce yourself, Daisy. Go ahead.
Thank you so much for having me, Fabi. My name is Daisy. I am a Nigerian. I live in Nigeria. I think I've been in Nigeria all my life. And yeah, I'm a special educator. I'm a mom, which is quite important. I'm a mom to an awesome 12-year-old. I like to say he's kicking autism every day, so he's doing quite well. I also am an advocate. I run a training center where I train teachers and therapists and parents to be able to work with or to support children with special needs. Yeah, I think
Wow.
that's pretty much what I do.
That's awesome. That's fantastic. Can you tell us a little bit about your child, the diagnosis, at what age, and how was your reaction after the diagnosis?
So he was, when he turned 1, he was fine until he turned 1. And a few months to his first birthday, he had a very, very horrible bout of diarrhea.
Mm-hmm.
And that was about the time I was weaning off. I was nursing. So I did the whole baby friendly, that's what we call it, the baby friendly. So all breast milk and, then off to food. So when he turned 1, when he was about turning 1, I started to wean him off the breast. And at about the same time, he had a very strong bout of diarrhea, and then we ended up in the hospital. But we were there for a couple of days. He had to be on antibiotics. He had to be on, quite a lot of medication. When we came back, it was then I started to realize that he wasn't quite, the child that had gone, into the hospital with me, but there were no obvious symptoms. I just knew that something had changed, at the time. And, so fast forward, say another 4 months, 5 months down the line, just progressively, he would drop a skill. Before he turned 1, he had language, and they were quite functional. He could say mommy, he could say daddy, he could count, and he would play with his elder brother, and try to, mimic what his brother was doing. But after he turned 1 and progressively till he turned to about 16 months, you know, we kept having him, lose one skill or the other and regress. So, the speech, the few words he had already were all gone. And then he started to hide in corners. He would get himself in a wardrobe, in a drawer. He just didn't want to, he would shut his ears, close his
Mm-hmm.
eyes. He started to babble a lot. So he would babble repeatedly with his shadow. So he became quite obsessed with his shadows, and then at the time we started to have him do the fecal smearing. So he would play with his poop. We started to have pica. He would dig up, the walls and, chew on them. Quite a lot of things started to happen at about the same time. And I became very worried, and reasonably so.
Mm-hmm.
So I took him off to the doctor, and each time the doctor would say, there's nothing wrong with this child. You're just comparing him with his elder brother, who at this time was a chatterbox. So you're just comparing him with his elder brother. And my husband felt the same thing. So over and over again, I would keep going to the hospital, and I would want to see a pediatrician, and I would say, I think there's something not quite right, something else, it's going on with him. And so it's was he really diagnosed before I knew? I knew before he was diagnosed that there was something not quite right.
Okay.
So at about the same time, I had a friend who came to visit with an 8-year-old, and I hadn't seen my friend for a long time. So we went to, when her son came right in, he went straight into my kitchen. He went straight into the fridge. He picked some food. So it was quite surprising that an 8-year-old would, get into my house for the first time and, head for my refrigerator and pick food, So I started to look at this boy, like, what's going on? And his mom was, apologizing and trying to, sort out things. So I started to ask his mother some questions, and she said, oh, well, he doesn't talk, there's no speech at all. And, it was obvious there was no eye contact. So I picked a lot of interest in that 8-year-old boy. And I said to his mom, I said, I think we should go see a doctor together. So I went with her and her son, to the doctors. And of course, the doctor, checked and all of that and still said there was nothing. So I had to go back home. And then she said, well, this is how it's been. Every year I go to the doctor and they said there's nothing wrong with the child. But so I went back home and I picked up my laptop and I typed 8-year-old, no speech, no eye contact, very active. So I put all of those there, and then autism popped up.
Yes.
And then as I began to look at so I decided to print out those sheets from the internet for my friend. And as I was looking through what I was printing out, I said, wait a minute, my son ticks off on everything, here, so I just knew that, there was something not quite right, and then I knew that it had to be somehow an, autism spectrum disorder, but I wasn't so sure. So back I went again. This time, I shared this information with my husband, and we went together to see, so at this time, we insisted that we had to see a neurologist. And so a neurologist was sent to us from another hospital. And he took one look at my son and said, oh, no, he's fine. He's very fine. So I was almost at the brink of tears, And my husband said, come on, do you want something to be wrong? And just as we're about leaving the doctor's office, my son suddenly, got out of my hands and went right on the doctor's table and pushed, and then the doctor says, oh, I think there's something, come back. And then he wrote one word. Yeah, so he wrote just one word on a piece of paper and signed. And that's when he said, go to the pharmacy. So I looked at the word, and it was the name of a medication. He had written Ritalin. And my son at this time was just 2 years, 2 years and a few months. So we went to the pharmacist, and the pharmacist said, who are you using this drug for? I said, it's for my son. I didn't quite like the look on her face, so I had to go. So all of that happened at that time. By this time I went back home and I read about the medication, first it wasn't supposed to be for his age, but I knew now that there was something, so the diagnosis came, I would say gradually. I didn't get a specific diagnosis till another 2 years later, when someone else, diagnosed and said, okay, yeah, he's quite smart. It looks like he has a pervasive developmental disorder, and then later I got the autism diagnosis, and, that was it. So it was kind of like a relief when I finally knew what I was up and against. Yeah, it was kind of a relief, but I did cry a lot. I did have a lot of nights when I cried, and
I understand.
I wet my feelings.
Oh, wow. And how is autism accepted culturally in Nigeria? How did your family, your friends reacted to your son's diagnosis, and what are the challenges there for the families?
Okay, so in Nigeria at the time, and even currently, it's largely dependent on where you are on the social strata, and then of course your educational background. So for more exposed, more educated people, it's easier for them to understand what's going on. But then we still do have in Nigeria a large population who are either illiterate or the semi-literate. So it depends on who you're meeting, really. And that would depend on the reaction that you would get. For me, I spoke with my brother. The night I got the diagnosis, I spoke with my brother, and he said to me, Daisy, if anyone should have a child on the autism spectrum, it has to be you. And I was surprised when he said that. And he said, because I know you're going to do something about it. So go read all you can, go do all you can, to help your child, So I had that support from him, though not physically, but, then I had a support from my husband who said, yeah, we can, get through this. But again, with society, especially when you go to places where you have a mixed crowd, let's say in the religious institutions where, you're going to have all sorts of people. Yes, I did get quite a lot of comments. I think one thing helped me because I have a very strong personality. So yeah, I tend to know that, okay, yeah, you're going to give me some negative vibes. So I just keep off. So I did quite a lot of that until I got to the point where I knew that, yeah, it wasn't about me anymore. The more aware people are, the more they would accept, So it's now became about preparing the world for my child.
Indeed, indeed. And just to know, what kind of services do you guys have there to diagnose and treat autism?
Okay, so in Nigeria currently, and it's been like that, I would say a lot of work has been done. We are beginning to have quite a number of professionals, spring up here and there, special education teachers. Now we have a board certified behavior analyst in Nigeria. We have about 3. We have, basically we have on the QABA board, we have qualified autism specialists. We also have people who have certifications now. However, we still have quite a huge gap as regards diagnosis. It's still, people still grope, people still, move. Doctors are largely not aware. And usually they will tell you that in medical schools, they don't teach them about autism. Autism is an example. It's not something they go to, study. But, good enough, quite a number of people are beginning to show interest in the field, rightly, and wrongly. So we have quite a lot of quacks and pseudo professionals, because we also have a large unemployment rate. And, so people can just wake up and say, okay, I may have read agriculture in school, but this parent needs a caregiver, so I will just go work with that child, and then they don't get any other certification. So we do have a lot of people coming up into the field because they, it's felt that it's a money-making field, somewhere they could make some money. But we also do have quite a number of people picking up interest in becoming developmental pediatricians, becoming behavior analysts, becoming teachers, and all of that. So yes, there's a large awareness growing, and then there's large interest growing, and then there's a huge body of parents. So parents are more aware, and parents are beginning to feel like, yeah, we have to do something. We can't wait for others to do this for us. So a lot of parents are becoming professionals, which is, quite interesting.
Awesome. And what therapies have you tried with your son? What worked for you, and what advice do you have for parents out there?
Fabi, I've done everything. I've done everything. Okay, so when my son was diagnosed, at the time I was studying to become a Montessori teacher. I was interested in becoming a teacher before he was diagnosed. So a lot of what I did was based on the Montessori method of teaching. So so I did quite a lot for him, because at the same time I realized he was hyperlexic. So he could read quite a lot, but with very minimal comprehension. So I started off with focusing on the autism using Montessori strategies, because that was all I had, with me. And then I moved on to, so I have therapists that I can't quite place what they were doing. I practically, physically, I would go on the internet and say, okay, I found this on the internet, implement, and then the therapist would implement, because they didn't also know any better. So I did quite a lot of mix and match. And did it help my son? Yes, it did. And then also it helped me. It helped me because I felt I was doing something, and there was some level of peace knowing that I was helping, him. But as he grew, the issues also increased. Quite a lot of issues, increased. challenges also increased. It was now more obvious. We had major sleep issues, for example, and he would go 48 hours, 72 hours without sleep. So which also meant that I had my own medical issues, because I also became, I lacked sleep. I became hypertensive because, I wasn't getting enough rest, and my husband was hardly, around at the time. He was off at work. So yes, I did quite a lot of medical interventions for him, what we call biomedical interventions. I had to go, do the test, the whole run, a lot of money checking for heavy metals, blaming the vaccines, and then the diet, quite a lot around that. But as regards therapy, yes, I started off with, like I said, the general things, and then I went on to do a foundation level ABA course, which was something I had heard of, and I became quite interested, in applied behavior analysis, but we didn't have enough professionals in the field. And then I think I didn't have enough mentorship, so somehow I fell off the ABA radar and went again into sensory integration, because at the time he had a lot, and he still does have a lot of sensory based behaviors, and I had to, check those out. So I did a bit of sensory integration therapy. I actually got certified as a sensory enrichment professional, and then I did a diploma in occupational therapy. I tried to address, some of his needs with occupational therapy, so quite a lot of mismatches here and there. And then I said to myself, wait a minute, all of this, ABA just has a way of tying them, putting everything together, because with the sensory integration therapies, for example, I began to see that instead of becoming replacement strategies for him, or becoming preemptive strategies for him, they became like a sort of a reinforcement. So we had quite a lot of negative behaviors coming up. So I had to go back to ABA, did my ROBT. So yes, I did quite a lot, for him. Sensory integration, sensory enrichment therapy, mendability. I did Qigong. There was this Chinese massage. I did Qigong. I did rhythmic movements. I did the Wilberger protocol. I did quite a lot. Quite a lot. And I tried to get certified, as much as possible in most of them. But by the time I got all of these different information, I had a clearer view to sit down to see really what works, and very importantly, what has the empirical, evidence supporting it. So I had to go back to applied behavior analysis, and this time I took our time to do the real coursework to get it done for good. So yeah, ABA I would say ABA has worked a lot for us. It's helped us. I think ABA, like I tell parents, ABA just wraps up everything. It wraps up everything, and then there's a strategy. There is a structure that you're going with that the other therapies did not provide. But you had the structure, you had the strategies, you knew why you were doing what. If I had to do a replacement strategy, I know that this is a replacement behavior. If I had to do something for reinforcement, I know it's reinforcement, not just mixing and matching everywhere. So ABA works. It's still working. It's still working for us. Yes.
Yeah, it's an evidence-based treatment. So yeah, I'll recommend that as well to parents. And last question, can you tell us about your organization, your own practice, what you do on site, and your last word for our parents listening?
Thank you. Okay, so I have about 5 different organizations. I run 2 schools, so basically they're inclusive schools. So we have other children and centers in 2 different states. At the therapy centers, we largely use applied behavior analysis, a little bit of physical therapy, a little bit of occupational therapy for those who would need it. But basically, I would say we're basically an ABA-based organization. So there we work with children who have more severe needs, moderate to severe needs. The mild to moderate needs actually are usually in the school setting, and then the moderate severe needs are in the therapy setting. So at a therapy session, we meet with parents, we do the initial assessments and evaluations. We do a lot of direct observation for across 2 days. We do referrals when we think that the children will benefit from, other expertise in other areas. So we do referrals to hospitals to get a proper diagnosis from a developmental pediatrician, and then they're sent back to us. Okay. We run a vocational skills unit for children who were not able to take back into the classroom setting and get them included in the classroom setting. Then we'll try the vocational skills depending on the interest, of the individual. I also run a foundation. The foundation, it's for children generally, so it's a childcare foundation, and there we take care of the needs of children socially, economically. We're also looking at a lot of sexual abuse amongst children, malaria prevention, basically everything for children amongst the poor and vulnerable populations, in the states where we work. I also run a training academy. So our training academy we're certified to provide trainings under the IBCCS board. And so we're able to provide trainings that enables teachers, parents, and other professionals to write the IBCCS Certified Autism Specialist Board exams, and all of that. We also recently got certified as a certified training partner with the QABA board. So we currently train ABA technicians, and supervise them to write the QABA board exams. And and then finally, I run another organization called the Ability Bible School. The Ability Bible School is a faith-based approach. Learning from my son, I realized that a lot of our children are not able to, beyond the school that is structured, the religious organizations, the churches, the mosques, they're not really as structured as a school. So they just so we have a lot of challenging behaviors coming up when they go to church, for example. So I started off the Ability Bible School for children with needs and their siblings, to be able to, look at, the faith-based approach and all of that. And finally, I run a Warrior Mom support group. Warrior Mom support group has about 600 mothers from about 15 countries, so we just basically talk, we talk everything. And so it's like a nest, it's a place where you can be vulnerable. You can cry if you want to cry, you can rant if you want to rant, you can complain if you want to complain, and then we share the joys and the successes. I've run that for about 4 years now, and it's been quite fantastic working with those women.
Is it on Facebook?
Okay, we started off on Facebook, and then we realized that mothers were not quite interested in discussing, so they didn't feel safe enough on Facebook. So we moved on to WhatsApp. We moved on to Telegram, and then back to WhatsApp. So we're on WhatsApp, and we have different groups on WhatsApp where parents, meet up here. So we have mothers from Ghana, Nigeria, Gabon, Ethiopia, Kenya, just everywhere.
Well, I'm gonna join that group. That's for sure.
Yeah, you're welcome. You're welcome to.
All right. Well, thank you, Daisy. Thank you for your time.
Thank you so much for having me.
Thank you. And
thank you so much.
We hope to have you soon, maybe, to ask more questions.
I'll be glad to.
All right. Thank you. Have a good day.